Ivy Berkey, and I'm going to be doing my probe video. My armamentarium is my PPE, so my gown, gloves, mask, glasses, my Marquise probe, neighbor's probe if needed, dental mirror, and floss. In this video, I'm going to be using my Marquise probe, and it is a double-ended, unpaired subgingival assessment tool. It has a simple, flexible shank that is circular in cross-section. It has a blunt, rod-shaped tip with no cutting edges. Its main use is to assess the health of the periodontium. It also measures pocket depths, measures clinical attachment level, width of attachment, assesses for bleeding, measures oral lesions, determines mucogingival relationship, and monitors the longitudinal response of periodontal treatment. Before I start probing on my patient, I'm going to ask them if they've had any past history of gum disease or periodontal treatment, and if they have any concerns regarding their gum tissue. To measure gingival recession is the apical migration of the gingival margin, and that is when the gingiva pulls away from the tooth, exposing the root surface. Gingival recession is the distance measured from the CEJ to the gingival margin, and all recession should be measured and recorded that is more than 1 millimeter. For frenal involvement, to check for this, you're going to check the maxillary frenum and the labial frenum. So you're going to retract the lips or tongue and perform the tension test. So you're going to move the lips back and forth and look for any abnormal muscle pulling or blanching near the attachment. To measure for width of attachment, you're going to get the total width of gingiva measurement, which is the distance from the gingival margin to the mucogingival junction, and you're going to subtract the probing depth from that total to get the accurate width of attachment. Anything less than 2 millimeters would be considered inaccurate. To check for mobility, you're going to use two blunt ends of two different instruments and place them on either side of the tooth and rock it back and forth to check for any mobility. Class 1 mobility is slight mobility, and that is anything up to 1 millimeters of horizontal displacement. Class 2 is moderate mobility, and that is anything greater than 1 millimeter but less than 2 millimeters of horizontal displacement. And Class 3 is severe mobility, and that is anything greater than 2 millimeters of horizontal displacement or vertical displacement. To measure furcations, you're going to use a neighbor's probe to do that. Class 1 furcation is slight involvement, and that's when the probe can detect the beginning of the furcation but cannot enter more than 1 millimeters in. Class 2 is moderate, that's when the probe can enter the furcation but does not pass through to the other side. Class 3 is surveillance, and that's when the probe passes completely through the furcation, but the furcation is still covered by soft tissue. Class 4 is severe furcation, and that is the same as Class 3, but the furcation is clinically visible, and there's no soft tissue covering it anymore. Class 3 and 4 furcations you can see on radiographs. To measure clinical attachment level, that is the distance measured from the CEJ to the base of the pocket. For a normal clinical attachment level, that number is the same as the probing depth because the gingival margin is at the CEJ and there's no recession or overgrowth. If there is recession, you're going to measure that recession from the CEJ to the gingival margin, and you're going to add it to the probing depth to get the clinical attachment level for recession. If there's overgrowth, you're going to subtract the amount of tissue above the CEJ from the probing depth to get that clinical attachment level. To check for open contacts, you're going to do that by using floss. You're going to check for space in between the teeth, and if there is any, you can measure that with a probe. So the next part of the video is going to be my probing video on Dexter. I probed the 8 lingual surface, 14 buccal surface, 24 facial surface, and 30 lingual surface. I also assessed for any bleeding or suppuration. Dexter did not have any of that. And for my measurements, for 8 lingual, I got 433, 14 buccal, I got 333, 24 facial, I got 333, and 30 lingual, I got 333. And after that video is done, I maintained a sepsis. Okay, I'll do 8 lingual.
see it on there?
Yeah, can you see
You want me
it
to
on?
Okay. Okay.
beige. So we'll move him.
Oh, that was just because I was trying to show you. No, I want you to do it. I want you to talk me through it, but you're not going to go back
And 30 Linguine.
Yeah. Okay. Just trying to figure out what we were doing. Okay. Yeah. Yeah. Do it on the next year. Okay.